Now, we can speak to Jamie Jenkins, who's former head of health analysis at the Office for National Statistics. And Jamie stood for Reform. You may well have seen him on the TV at the recent Senedd elections. Nice to have you on the programme. How are you doing?
Hi, Gareth. You okay?
Yeah, really good, thanks. Look, I appreciate there's no absolute in predictions or working out what might happen here. But as a starting point, what do the data tell us at the moment about how well the vaccines work against this Indian variant?
Yeah, so it's early days with regards to the Indian variant because we're only kind of just picking this up mainly within the UK. But the early indications are that the lab data does suggest that the vaccine's effective against this variant and the South African variant that we were talking about in April. And remember now, I can guarantee, Gareth, we'll probably be talking about another variant in a couple of months' time because being a kind of respiratory virus, these viruses do mutate all of the time. For example, the flu virus has lots of different variants. And every year when we have the flu vaccine that people have, they do modify the flu vaccine to combat different variants. So the good news is that it's looking like it's effective against the kind of the new variant, in particular the Indian variant. I suppose what we'll be looking out for in the data over the coming weeks is that I suppose the Indian variant coming in at this point in time, when we're opening it up, not just in Wales, but in England and Scotland, is I would inevitably expect cases to start going up as you start allowing more and more mix-in. But what the vaccine does do is it's broken that link between cases leading to hospitalizations and then leading to death. So we inevitably probably would have seen cases go up anyway, but then we've obviously thrown the Indian variant in the mix as well. So it'll be hard to distinguish between the two.
And look, as far as the vaccines go then, perhaps against the Indian variant as well as the others, do they stop us catching COVID altogether on the whole, or do they stop people becoming seriously ill and needing to go to hospital with the virus?
So there's a bit of both going on at play. So if we just look at, say, the latest week's data, we've had about 300 new cases in Wales and 75% of them have been under the age of 50 and half of them have been under the age of 30. And the younger we get, that's where the vaccine rollout hasn't gone as far as that. Now, I've looked at the data earlier on today, back to December, when we were looking at new cases each week, and we were seeing a much higher percentage of those new cases among the people over the age of 50, where we know hospitalizations and serious illness kicks in. So the evidence from researchers and epidemiologists have been looking into this, that it's not just that it protects you from serious illness, it's the viral load is lower as well, so you're less likely to transmit it to other people. So as the vaccine rollout continues to go to, say, younger age groups, and that's where we see a majority of the cases at the moment, you'd expect the transmission to go down in those age groups as well.
And Jamie, there's been a bigger emphasis, I think, anyway, perhaps you may well correct me on this, over the past few days about getting the second dose, perhaps a bigger emphasis than we've seen before. In England, for example, they have narrowed that gap between first and second from 12 down to 8 weeks. Does that suggest that, I don't know, perhaps there's a scientific realisation that that second dose is even more important than we thought it was before?
So we always thought we'd need 2 doses, but then the indication was showing that just that first vaccine dose gives you that extra, quite a good protection against it. And then the second dose gives the extra protection. So I think we've had deaths in Wales now, Gareth, for the last 2 months below average, and they've been below average in England for the time of year as well. So I think what they're probably looking at is because the Indian variant is kind of unknown with regards to how kind of it might impact on, say, the more vulnerable people. And remember now that of those people who are vulnerable, 99% of deaths have occurred in people over the age of 50 and young adults with health conditions. And we know that for the first dose, 95% of people have had that. So the majority of people have got a vaccination that protects them. But if you speed up and get the second booster dose to those individuals, then any worry about new variants and the impact of all of those would be kind of diminished. So I think that's probably where we go in terms of giving that booster dose so that people can be less concerned about the impact of any new variant. And as I say, I think the public don't need to be too alarmed at the moment. The indications are that the data is showing that the vaccine's effective against these new variants. Cases are still relatively low in the country. They're not really going up at the moment at all when you look at the broad picture. And say the key number, Gareth, I think, is to look at overall deaths, and in Wales they're below average, and they have been for 2 months, which is good news.
And very quickly, and this is not to hold you to a prediction at all, I promise that, you'd expect a pattern then, would you, over the next 3 to 4 weeks, perhaps of higher cases inevitably, perhaps because of variants, definitely because of the opening up, but not that rise in hospitalisations and deaths that we've seen before?
No, so in Wales at the moment, we've got 22 patients in hospital who have confirmed to have tested positive for COVID-19. Now, they could be in for other reasons and happen to have tested positive. It was over 1,600 back in January, so it's a 99% fall. Now, I would expect to see more cases as more mixing goes on, in particular among younger people, which is what we're seeing in the data over the last week. The other thing we might see as well, especially with some of these test events that are going on, we are testing more and more people. So testing's starting to uptick again. And when you test more people, you find more cases. So I think the challenge is going to be to kind of hold the nerve. We will see a rise in cases. And we shouldn't be then thinking, well, we need to put more restrictions in. We need to follow the data then and look in terms of how does that impact on hospitalisations and deaths. And if the vaccine's doing as it's currently working, Gareth, that break that we've seen because of the vaccine between the link of cases and deaths, if that continues, then it's good hope for everybody as we move forward through the rest of the year.
Great to speak to you. Fingers crossed as well that that bears out, Jamie. Thanks very much indeed. Jamie Jenkins. Hope that helped, by the way.